Alright guys, we're doing prolotherapy on a knee today. Prolotherapy's got a lot of different uses. It really shines on joints, tendons, ligaments, soft tissues, lots and lots of uses for it. So when we do this, it's not just the traditional one injection and we're done. We do an intra-articular injection of 25% dextrose, the rest of it being locally anesthetic. This does a couple things. One, it helps to kind of heal the inside of the joint. The other thing is that it kind of anesthetizes all the extra articular tissues, so it makes it a heck of a lot less painful when we do these other injections. So the actual procedure itself, I've actually had it done myself, is not bad at all, and I don't just say that because I'm the one doing it. My wife has had it done, and the lovely patient here is having it done today too. So we're going to kind of get started here. I'll talk you through what we're doing as we do it. Just kind of feeling around where her actual joint space is. Do me a favor, grab that blue bump. We're just going to put it under behind you. There's your knee up here. Yep, perfect. So this just kind of opens up the joint space, lets it gives us a little more room to work here. Our patient today has some issues with going upstairs. Has a lot of pain, feels like her patella is painful as she's going upstairs. So a very common thing with patellofemoral syndrome. So here we're just kind of marking where the entry into the joint space is here. Nothing, no sticks just yet, I promise. You can breathe. All right, we use a lot of cold spray here so you don't feel it here. Cold, cold, cold. And so we just do, we're in the joint space there. We're just gonna give about 8 cc's into this joint space. It's a little higher volume than we would do it for a typical knee injection, but again, we're trying to anesthetize kind of some of the surrounding tissues as well, not just the knee capsule. She's not crying yet, so I think that's a good sign. May feel a little fullness, but that should kind of be the extent of it.
What's the downtime for this procedure?
It's a good question. So I kind of use the analogy of if you take a towel and you get it wet and you wring it out, that's going to kind of make it stretch. So essentially what we're doing is putting this dextrose into the fibroosseous junction of the knee where the ligaments and the tendons attach, and so we don't want to stress the knee a lot initially afterwards. I would say no heavy bending, squatting, anything like that for a good probably 2 weeks afterwards. We want this to heal. There's a couple phases of inflammation that the knee goes through when we do this. I'm gonna let that sit for just a little bit, let you get numbed up before we do these other parts here. So a good rule of thumb is at least, and truly when we do this, I like to follow up typically around the 4 to 6 week mark. That first week, there's going to be a little bit of inflammation, not uncommon by any means. That second week, the pain should start to subside. Really around week 3, week 4, they're going to start feeling better. They're going to notice an increase in their functionality, decrease in their pain, and all these benchmarks that we want to see. This is something that if there's improvement and they're showing increases and improvement in all these, we do, sometimes we'll do a series of 2 or 3, depending just how they do. It's very patient dependent. There's not kind of a cookie cutter way to do this. So would you grab me a gauze, please, ma'am? So we're just kind of letting this set up on her knee, the local setup. That way we get her knee really good and numb. The second part to prolotherapy is that we kind of inject all of the extra articular We inject all the extra articular spaces too, and so that helps to really fortify some of the attachments. Sometimes we can even get on the underside of the patella, which for her, that's a big area of pain for her, so I do want to make sure we do that. We'll do a little bit different technique. I'm going to put her feet out. You can move the patella. You probably noticed when your legs are sitting stretched out, you can move your kneecap back and forth. That's what we'll do just to kind of get to the underside of her patella. So we'll start kind of working here on the other aspects of it. And we kind of just work our way around here. We'll just take care of it. And we're doing not a ton of volume each time. We're doing, you know, about a cc and a cc or half a cc. Nothing too crazy. She's not screaming or crying yet, so that's a good sign. She's holding it together. She's tough.
I know you said to hold off afterwards on NSAIDs.
Yeah.
What's the purpose of that?
Yeah, we're causing, and it sounds kind of goes against what normal medicine says. If there's inflammation, we give anti-inflammatories, right? So we want to, this is kind of a different way of thinking. Think more regenerative in nature of what we're doing here. We want to cause inflammation. That's the whole reason we're doing this, is to cause inflammation in and around these tissues. And so by taking NSAIDs, we essentially stop the effect of what we're doing here. NSAIDs, steroids, they're all going to kind of stop the action of this working, and we want to obviously get the most benefit for the most bang for our buck when we do this. NSAIDs, again, they're not actually fixing anything that's causing the issue. We're just kind of stopping the action of the inflammation, and we want that inflammation to occur. I would say as far as the timeline, you know, essentially the duration of what we're doing this. So I would have patients normally hold off on all this for, you know, a good 4 to 6 weeks, reassess how they're doing, and if they're doing okay, then you know, hopefully they don't need NSAIDs in the first place, but then they can kind of resume their normal activities. Just being real meticulous here. We like to do kind of a surgical prep on where we're going here, using lots of cold spray for her comfort, just to obviously make this as comfortable for her as possible. Nobody likes getting stuck with needles, but she's doing very good.
What other areas can you use Prolo for?
Yeah, it's a good question. Really anywhere, any joint in our body, anywhere there's soft tissue, tendons, ligaments. We do it in the back, the neck, SI joints, shoulders, elbows, fingers. I mean, you name it. If there's a joint there, if there's a tendon or ligament attaching it, it's a good therapy. In my practice, I don't use steroids a lot anymore, just because steroids don't fix the underlying issue. This is actually healing and regenerating at the source of the problem. So this is a big part of my practice that I do, and I believe in it so much just because I've had it, and I've had a lot of patients that do really well. So I'm going to ask our lovely patient here, which is there one side of your kneecap, your patella, that you feel more pain in? I know initially it said kind of behind it. Do you feel more on one side or the other?
Probably the inner side.
The underside or the?
This inner side.
Oh, okay, underside. All right. So now we're just going to kind of extend our legs just a bit here, just to make this a little more accessible. I'm going to take this out from under your.
This one.
No, it's okay. You can kind of see here how we could manipulate the patella just a bit. Actually do hang that leg off the right side for me if you don't mind, please, ma'am. Thank you. Perfect. Just like when you were a kid and you were like, oh, look at my kneecap, it's dislocated. There's laxity in the kneecap there. A lot of patellofemoral syndrome and issues with the knee come from the patella rubbing on the under surface of the femur. So again, we're just gonna clean our area here, make sure we're good and aseptic. Cold here. And again, each time we're doing this, we're just kind of redirecting and depositing just a little bit of this dextrose solution. The goal being to really spread this area out on the problem areas, I should say. We got kind of the superior aspect of her patella there. I just want to touch up kind of the inferior aspect there, and then we will be done.
So fairly quick, in and out, less than 30-minute appointment for sure.
Absolutely, yeah. Nothing, no real downtime as far as that goes. Just try to take it easy. Like I said, again, no physical strenuous activity, nothing, I don't want you box jumping or doing a lot of running for a bit. Just try to give it a rest, because we're causing inflammation, and we want that inflammation to run its course and do its thing. We don't want to stop that with anything. The other big thing I tell folks too is no ice. I know ice is one of those things that you have an injury, people reach to ice really quick, and that's okay for a lot of things, but in this instance, ice is an anti-inflammatory, so we want to hold off on that. Truly, Tylenol and heat are going to be your best friend. So we're all done. That's kind of a brief rundown on knee prolotherapy. Again, we use this a lot for a lot of different applications: shoulders, hips, knees, necks, backs. So stay tuned for some more treatments.